Hi everyone, I'm Steve Main, here with Dr. Nario of Biointegrative Health Center in Reno, Nevada. If you want to reach out to me, you can get me at stevemain.com. That's a good place to leave me a message or whatever, however you want to get a hold of me. Dr. Nario is at Biointegrative Health Center. You can also look them up online and see all the different treatments and things that they do there. So thanks for being with us, Doctor.
Hi, Steve. Thank you for having me again. Always a pleasure.
Okay, so we're going to talk about testosterone, a very interesting topic, but I think a thing that's not talked about enough. The dangers of low testosterone, which would be mostly for men, but low testosterone is not something that you want. So, can you just start off talking a little bit to us about what are some of the dangers of low testosterone? And then we'll get into what's low and all that stuff. But what are some of the dangers, things that could be harmful that could affect you in other ways, like maybe your heart or whatever? So, talk talk about some of those things.
Well, Steve, let's start with the most common question. What is testosterone? I mean, just a refresher course for our audience here. So, again, this is a steroid hormone, and it helps in the development of male secondary sexual characteristics like hair growth, sex organ development, body structure, and it's produced by our testicles. In women, for ovaries and adrenals. And when we talk about men, we're going to be talking about men today, not to just isolate our female audience, but we can probably a different topic for them. But definitely, for sure, there's separation that needs to happen when you discuss testosterone for females and men. And the thing about this is, uh, I want everybody to, I guess, be reminded about our common parameters for labs, which is LabCorp and Quest. So they defined testosterone to be normal between the areas of 200 to 1,000. Now you would see that on the sheet that they give out. But paradoxically, American Urological Association had mentioned that testosterone, which is total testosterone below 300, which is nanograms per deciliter, is a reasonable cutoff to support the diagnosis of low testosterone. And on the side of that, they also want us providers to take blood tests of two separate measurements taken in the morning so that we can really verify if it's a blood level less than 300 for us in order for us to diagnose somebody with low testosterone and give them testosterone replacement. But if you follow LabCorp requests, you can see that there will be, and if a clinician is not aware of this below 300 recommendation of the American Urological Association, there are so many cases that will be missed. And again, my point there is there are many people out there walking around this earth, and especially men who are actually feeling crummy and does not have testosterone, and it's very easy to treat. And again, there are other ways to determine testosterone levels, even more accurate ones, which is the free T calculator that I use and other providers as well. But again, that will be discussed in another segment. But my point there is lots of men out there needs help.
So, what are some of the dangers? What if somebody's low? Why is that important to get it up into that normal range?
Right. So I guess your question is again is when we talk about the dangers of testosterone, there are so many things to think about. Some of the dangers would be, again, there are so many things that we consider why testosterone is being used for libido, for weak erections, for energy. So those are obvious reasons why we need testosterone. But there are things that we don't see, and we mistake these changes for aging. Number one, cognition for men. So hopefully we're not leaving the stove on, the house is not on fire after we leave, and even little things like subtle memory of where I place my car keys or receiving the proper change. So cognition is number one, and testosterone plays a very big part in this one. Irritability or mood of men. We think that we're just crummy, like women going through menopause. And of course, the wives know, or the women knows about this a little bit more. But there's a term called andropause as well, where men get moody and also crummy. And another one is osteoporosis. You always hear this word about bones of women breaking down. Men, they also happen. So this is when older men suddenly has unexplained fractures. They just got hip checked in basketball and broke a hip suddenly. And even worse, strokes and heart attacks. They are common due to cholesterol and blood pressure, as everybody knows and every clinician knows. But you will rarely hear that there is a correlation between low testosterone and these two pathologies, and there are medical evidences about that. That's why all of these complications that I just mentioned, all related to low T, and these are not the obvious ones that we know about.
Okay, so you kind of that really that answers it. That I know that it's a broad spectrum, um, and now and you also kind of gave us the range that someone is supposed to be in, but everyone's going to function differently, and you want to get the right range for you. But what are some of the symptoms? Because I know some men in their 30s are getting symptoms, and you touched a little bit on this, on what the dangers are. But what are some of the specific symptoms for someone like maybe in their 30s where they're getting these symptoms, um, where they could be suspicious, maybe their testosterone is low? What are some of those symptoms?
Right. Well, Steve, the most obvious one for men, even for the younger ones, will be more of the physical manifestation, meaning muscles. Like muscles are shrinking. That's why you hear testosterone being used in the gym, for example, bodybuilding, because they produce bigger and I guess toner muscles. And again, if for example, if you're exercising, you're not noticing any growth in your muscles, that's an indication that hey, maybe we should check testosterone. Another one would be libido. Gone are the days sometimes when you're a sex machine for your partner, and then again now you became a couch machine instead eating chips and drinking beer. So again, there's again that's another clue that testosterone probably is getting low on this patient. Another one would be weak erections. Flag was still up, and now it's only half mast. Even with all the pep talk, it's not listening. That's part of the manifestation. Another one, energy. So we always use testosterone to like ramp our days up. We're cartwheeling through life, and now we're flat as a pancake. And again, these changes are very hard to see when you're older, just because we accept this in society as normal aging changes. But again, with younger population now, and I see a lot of them, these are the initial symptoms that I usually hear from them. So they consult a doctor, and now we discover that these are the low testosterone patients that we now have identified.
Okay, so is there a time when you start to see, or where men start to produce less testosterone, when it starts to get lower? Is there an age or a range that you can give us? I know this is very general because everyone's different, but what do you see? Do you see it where testosterone starts to decrease at age 40? Is it 50? Is it Tell
Right.
us about when it starts to decrease, and when, even if you don't have symptoms like me, I don't have any symptoms of low testosterone, and I'm 60, but we get it monitored all the time. So even if someone doesn't have symptoms, maybe their testosterone's starting to dip. At what age does that happen, or can it happen?
Well, Steve, that's a good question because everybody thinks that it's 40, it's 50. So everybody has a different number. The thing here is testosterone peaks in puberty. And also, this is, as you remember, the body changes also. And the days when you're shy about the body, you're a hairy werewolf, and you have BO, all of these things are happening when testosterone spikes for men. But the basic age that you have to remember is it starts to decrease at age 40. The blood testosterone lowers down 1 point per year, and it's also accelerated if with disease, I mean, other conditions ongoing with it. But now in the clinical practice that I have, I see patients at age 30. And the reason for that is it's not because the testicles are shrinking or it's not working. It's more of the ongoing stress or chronic illness that they have. And I'm seeing more infertility cases also in men with low testosterone due to external factors, such as heavy metal contamination, inflammatory conditions such as obesity, hypertension, even cholesterol problems. That's why the things that we do every day is actually contributing for that eight, age 40, as I mentioned to you, to become earlier and earlier. And that's the bigger problem now that we need to address in society.
So is there an age, last question. So is there an age where you just automatically put that on um, someone's chart to get tested when they do their annual blood work? Is there a certain age where you just automatically put that on and say, we're going to test it?
Right. So that's a good question, Steve. The thing here is, as I mentioned, 40 is a start when you drop testosterone in the blood. My suggestion here is definitely, and you can have a talk with your clinician also to get baseline levels. So you would really know where you're at. And as you move forward, you start to monitor it. And usually, unfortunately, for insurance purposes, we can only request when men starts to complain about symptoms such as fatigue, ED, low libido. And usually, when you find these specific symptoms, the testosterone is already low. So you're not being preventative in this specific approach. But again, we're following insurance policies here. But if you see, like us integrated practitioners, we are more proactive about finding these things. And again, as parting words, as a reminder, weak erection is not giving you that much needed of a home run. Low muscle mass makes you look like you're dried up like a prune and would not kill you. All these physical symptoms of low testosterone. The one that I really want to emphasize is systemic, long term complication of low testosterone, such as increasing the chances of diabetes, hypertension, strokes, and heart attacks. And even the osteoporosis, everything that I mentioned a while ago, is why I want to treat testosterone for men. And of course, the physical symptoms that I just mentioned are there, but this is the more important points that I want to bring out there.
Okay, that's great information for all those listening. And it's like, yeah, if you start noticing your body composition changing, less muscle, more fat, that's a very strong indication. You might feel really good, but your body composition's changing. It's This is something that you want to put emphasis on, and sooner rather than later, because now you have a baseline, and then when you get it checked later, you can see, oh, it dropped this much or whatever. So
Right.
thank you very much, Dr. Nario. Dr. Nario is at Biointegrative Health Center in Reno, Nevada. Do a lot of great treatments, and you can look them up online and see all the different treatments that they do, as I mentioned before. So thanks for being with us, Doctor.
Well, Steve, thank you so much again for having me. As we all know, that knowledge is power, and thank you for letting me provide you with edge in longevity and health maintenance, which I call the biological edge or the bio edge.